Godspeed, Luke. Before we move forward, at the other end of the spectrum, I want to briefly address the images on I can't believe this, on social media this morning from the New York Young Republican Club that allegedly snuck into Jersey City last night to hold a gala fundraiser after they couldn't find a venue in their own city due to the pandemic. So from the videos on social media, and certainly this picture, there is no obvious attempt to enforce social distancing or face masks, even though wearing masks indoors in New Jersey is mandatory at organized gatherings when individuals are not eating or drinking. It is beyond the pale that anyone would willingly endanger people in another state, never mind their own. It is also beyond the pale that a member of Congress, actually go back if you could, would participate in this. And that is, no, I want you to go back to the group if you could, Mahan. That guy in the middle, the tall, handsome fellow in the gray suit, that is Representative Matt Gaetz. And based on his past performances, it is obvious being a knucklehead is not beyond the pale for him. He was actually Sarah Palin's backup act for this event. Now, if you go to the next kind of a scene, that's Matt again, earlier this year. Kind of a scene out of Dr. Strangelove. What a fool. He and they should be ashamed of themselves. He is not welcome. I hope you're watching, Matt. You are not welcome in New Jersey, and frankly, I don't ever want you back in this state. Now, to be sure, and Pat knows this, Jersey City law enforcement is currently investigating this matter, and we will assist their investigation in any way necessary and take action as appropriate. Next up, again, from that gear to something that actually does matter, several New Jersey hospitals are pre-positioning to receive the first shipments of Pfizer's coronavirus vaccine. We anticipate that the first distribution will include a total of 76,000 doses, and there will be shipments, I think we can assume, every week thereafter for the foreseeable future. This pre-positioning is important to ensure, first, that delivery and storage systems work, and second, to assist the federal government in expediting shipments and delivery. We will be situated to begin providing vaccinations once the vaccine receives emergency use authorization from the FDA. As we continue to prepare for the first tranche of vaccines in New Jersey, we are exploring every avenue to maximize efficacy and efficiency. To that effect, today I'm signing an executive order to change the inclusion into the New Jersey Immunization Information System from an opt-in to an opt-out program for any resident who chooses to receive a COVID-19 vaccination. This means that if you wish to be vaccinated against COVID-19, and believe me, if we tell you it's safe, we want you to do that, you don't have to first opt into the system to make sure that your two-dose regimen is properly tracked and managed. In 30 days after the current public health emergency ends, which I hope is sooner than later, individuals who enrolled due to the COVID-19 vaccine will be afforded the opportunity to withdraw from the system. Let me be perfectly clear, this order does not force anyone to receive the vaccine, although we are going to be strongly recommending it, assuming we put our good housekeeping stamp of approval on it, and you should assume that we will. So we're doing this for a simple reason, to ensure that those who choose to receive a vaccine get the most effective course in the most streamlined manner possible, on the proper timetable, and without logistical or bureaucratic hurdles in the way. This is most critically important for our healthcare workers, emergency responders, and essential workers who need the additional protection of an effective vaccine as they continue to confront this virus on the front lines. And to be sure, we are ready for this moment. Before I go on, I just want to make sure folks have some historical context. I think this was during Governor McGreevy's term, when it was determined on vaccines generally, if you were born after 1998, you were automatically opted into this system, this record keeping. If you were born before 1998, you could opt in, but that was not the default. The default was you were opted out. So what we're saying through this executive order is very specific to the COVID-19 vaccine. Everybody is in, and you will have a chance at the end of the public health crisis within 30 days to opt out. We've got to have everybody's information. The federal government needs it, we need it, you all should want it and need it, so that we can track these dosages and make sure that it's as safely and efficiently distributed as possible. So as I say, we are ready for this moment. Judy Persicelli and her team, Tina to my right, ably representing them, have been working on plans for vaccine distribution since last March. And the state's initial distribution plan was filed with the federal government in early October, and that plan has been further refined since. Nothing is being left to chance or improvisation, and we continue to work closely with our hospitals. The light on the other side of this pandemic is real. It is now becoming visible, and this is a game changer. To be clear, the mere presence of a vaccine in our state does not mean that we can flip a light switch and remove all restrictions or lift every advisory. COVID isn't going to simply vanish just because there are vaccine doses in a freezer waiting for distribution. This is going to be more like a dimmer, and the light will get brighter and brighter and brighter over time. And the over time here really is between now, maybe as early as next week, and April, May. This is not forever and always. To get to full brightness will take, as I say, months, and it will take millions of New Jerseyans getting vaccinated. And we're going to do all that we can to ensure confidence in the vaccines that we ultimately approve for distribution in our state. But again, even though a vaccine is on the way, we're still going to have to commit to wearing our masks, social distancing, and keeping vigilant. But an end can now be considered a when and not an if, and we can count it in months. We just have to hang on together, everybody, a little bit longer, and that's because this virus is still moving throughout our state, and residents are still falling ill. To that point, as of last night's report, our hospitals were treating 3,315 patients. Of that, Matt, 3,073, I made to make sure I had that number today, were known COVID positive, with the balance awaiting confirmation from their test results. Again, 3,315 total, 3,073 are confirmed COVID positive. Of that total number, 615 were in intensive care units. And of that group, 386 ventilators were in use, and I think, Tina, that is the highest percentage of folks in intensive care in many months. Discharges yesterday, this is good news, 362 patients live. Patients left our hospital. However, 385 were admitted, and these are not confirmed yet, but there were 49 in-hospital deaths just yesterday. And again, they're pending confirmation. Bless them. Today, we are recording an additional 5,673 cases, meaning a 9-month total of 356,662. And we know that some of these newly identified positives will ultimately end up in the hospital. This is a point we've been trying to hammer home, folks. The fewer new cases, the fewer new hospitalizations. And I have to say that this is math. This is a direct cause and effect. It's perhaps the biggest reason we need everybody, please, to keep up with the practices that allowed us to crush the curves in the first place. The fewer people in the hospital, the less pressure and less risk of infection on our hardworking and heroic healthcare workers, and we need every single one of them. We're not reporting it yet. Judy and I had a conversation with Pat earlier on this, but we're increasingly getting better data on the antigen tests. These are PCR tests, and I hope sooner than later we'll be able to give you some sense of what that number looks like. But trust me, there are more cases than 5,673 when you add in the antigen tests. So the positivity rate for all of those PCR tests, and they were recorded on Monday, was 10.42%. That's based, by the way, on Monday there were 49,845 PCR tests done in the state of New Jersey. The statewide rate of transmission continues to be in a better place. It's 1.05, but I want to say this in a way we haven't said in a while, and again, Tina, I'm practicing without a license here. How can you have a positivity rate that's as high as it is and a rate of transmission that is trending in the right direction? The rate of transmission relies upon a rolling average of the total number of positives, regardless of what the denominator may look like in terms of the total number of tests. And you've seen lately the rolling average has been in a range of positives, and I mean raw numbers here. It's been plus or minus 4,000 over the past number of days. I suspect, I don't know this, but when you factor in today's positives and we begin looking out a few days from now, that rate of transmission, unfortunately, is going to start to creep up again.